What's going on, guys? So I wanted to share something important with you today because I think we need to all think about this. But we got hospitals closing, babe. Like we have hospitals closing en masse, in the hundreds as of right now. And when the bill was first fucking signed by this douche, we already had hospitals on the brink of closing, and it forced them to close. I actually covered a nursing home that unfortunately closed, and the ultimatum they gave their residents was either you can find a facility that will house you, or we're going to put you in a shelter. And you're going to see a very running theme in my videos. I talk a lot about the shelter because it's a horrible place and nobody should be there, especially if you're elderly. But the hospitals that are closing, they're in rural areas, and also a lot of them are in urban areas. And of course, this is, due to the fact that a lot of Medicaid was cut, a lot of Medicare was cut. People were reclassified if they were either able-bodied or not able-bodied, disabled, whatever the case may be. And then on top of that, you have working Americans that cannot even afford insurance. Some of them have spiked drastically over the years. But I wanted to show you this one article from Infectious Disease Advisor, because obviously we do not even have any source of actual information. Our legacy media is pretty much dead at this point. Everything is on YouTube. So it's like you if you want to find out news, we go to Aaron Parnas. I know everyone that even would look at this goes to Aaron Parnas. I go to Aaron Parnas religiously. But I mean, as they're sitting there and saying, like 60% of the hospitals that are closing down are in urban areas. Now, this is going to sit there and backlash on us. Why? Because the fact of the matter is, not only do you have people in rural areas that need to probably go to the next town over in order to receive any kind of health care, the ones that are in the urban areas that are still open, they're going to get overrun. They're going to get completely overrun. And let's not even listen, let's not even like talk about the fact that there's a shortage of labor as it is in hospitals. And I wonder where that happened from, right? And then on top of that, you have nurses quitting en masse. So it's like this affects us all. And then there's another part to this that I want to talk, but I want to talk to it after this video, because I picked up a video from Reuters that kind of depicts what's really going on from their side, from the actual rural side of hospitals closing. So let's get this bad boy rocking.
Rural health care in the U.S. is under threat. Nearly 90% of the land in America is rural, and some 60 million Americans call it home. But there are only about 2,000 hospitals to cover them, and over 40% operate at a loss, a marker of closure risk.
Closing of rural hospitals will jeopardize people's lives every day in the state of Kansas.
So why are such essential services so vulnerable? Well, rural Americans rely more heavily on Medicare and Medicaid than people in metro areas. Those are subsidized federal health insurance programs for certain eligible groups. When patients have coverage, hospitals are reimbursed more reliably. But it's complicated. Under Medicare, for instance, there are different sets of rules for how much rural hospitals are reimbursed. And with low volume and high costs, many rural hospitals have shifted away from expensive.
And that also comes from the fact that, like, to say, if you even meet the medical necessity to sit there and even have tests or have labs done or have procedures done. So let's not forget the fact that, like, they kind of did this to themselves as well, because they denied a lot of people that had, like, crappy insurance or wouldn't accept their insurance. So also kind of their fault.
Inpatient care to focus on outpatient care, but that means smaller billings. And since 2005, more than 100 rural hospitals have shut down entirely.
A lot of hospitals are closing because they can't make it.
Adding to the challenges, in 2025, Republicans passed legislation that made nearly $1 trillion in cuts to Medicaid over the next decade.
And they're cutting more. Why? For the fucking war.
A White House spokesman has said rural hospitals have chronically low usage, and more Medicaid spending in the past had not helped. But the administration has approved $50 billion in funding so states can adopt healthcare reform to make rural hospitals economically viable again. Check out the full story on Reuters.com.
Yeah, but see, here's the whole thing, right? Realistically, if they didn't even sit there and tamper with half of the things that they did during the bill, we wouldn't even be here. Like, these people have literally sat there and set the world on fucking fire. Now, let's go beyond that, okay? Say you do live in a rural area, and say, like, the next hospital that you have to get to is the next town over, because I used to live in a small town, okay? I used to live in a small town for about 2-3 years. It was 500 people max. All right. So I know the whole deal of this crap. And now you have gas into play on top of medical. So now you have to find a way to get to the next town over, get there, and hope they accept your insurance. If you have any insurance to begin with. And if not, you got to pay out of pocket, which then on top of that, right? So now that's how it's going to completely trickle down, is the fact that if you don't have Medicaid or Medicare, then they're going to ask if you have insurance. If you don't have insurance, they're going to ask if you're a military and have TRICARE, right? And if you don't have TRICARE, you're going to need to pay out of pocket. And those people that are going to pay out of pocket are going to pay probably about 20 times more than what they used to before Bozo got in the office, right? And like I said, also with the gas prices going through the fucking roof, how much do you think an ambulance ride is going to be? And if your insurance doesn't cover it, hefty bill in your pocket. I mean, they already did it to the post service, right? For packages. They're going to do it to this. And from what I hear today was the last shipment of oil that we actually got from the Strait of Hormuz. So, I mean, listen, man, either way you slice it, we have to find a way to really pull together and keep ourselves straight. So I'm literally talking to like nurses and doctors. Malpractice be damned. All right. If things are going on in your area and you can sit there and help people, I mean, granted, you can't sit there and prescribe medications, but if you can do like, basic triage to keep people going, please do so. As always, people, I love y'all. I appreciate y'all. While you're out there, please be safe.